staying physical aspect of OT, whereas I'm on the mental health side, and I don't really carry out as many or anywhere near the physical aspects of it. So it's more around engaging my patients in meaningful activities, optimizing their life skills. If they are moving on to the community, making sure that they are fit and feel independent in themselves to take care of themselves, and just getting them ready for whatever chapter is next in their life. And there is a big difference, but they are both as important as each other. And I find my role to be very rewarding because it's not as fast paced as Beth in terms of she has new patients every day. Mine's more long term, so I work with the same patient group for months and months, maybe even years on end, just trying to help them get to their optimum self. Optimum self.
I think yours is much more OT, whereas we've kind of this is going to be cropped, yeah. I think where you work, it's much more kind of meaningful, goal specific, whereas mine's, because I'm in hospital, it's very much kind of what can we do towards getting this person discharged back to engaging in their activities of daily living and home safely.
Yeah. But Beth, you're on a rotation, aren't you? So
yes.
She will be changing every 6 months or so and experiencing different aspects of OT. Whereas I'm in a fixed job, so I will be in the forensic secure side until I decide to change. So Beth will have a more rounded experience.
Yeah. But mine's much more physical.
Yeah. Hers is much more physical.
We've gone the two different routes of OT.
Yeah. But we both enjoy it, don't we?
Yeah.
And we always try our best to spread the word of OT, especially in my job. It's always try to educate people on what OT is and how important our role is and how much of a difference that we actually make to our patients. And with OT, you'll find that probably you will be doing that throughout your career, and that's fine. That comes with the role. That's okay.
It's a really rewarding and fantastic career, and every time you see someone, you know, they're so thankful for the difference you've made and how you've helped them and how you've got them closer to getting back to what they want to do, and, you know, activities they enjoy, meaningful activities, and engaging in things that they need and want to do.
Yeah. And I think one positive about YSJ is we had 4 placements throughout our degree, and where Beth works now, I was on placement there. So I have an understanding of what her role is and an experience into her day-to-day life. And I really valued all my placements that I was able to go on at YSJ, because they just really gave you the understanding and insight into what OT is and that hands-on experience that other degrees won't really have until you probably graduate and get a job. And that really sold it. I think we did 1,000+ hours of physical placement, which is long, but it's still probably the best part of the degree, I would say.
You really know what you're going to be doing after you graduate, because you've had all that experience.
Yeah.
And at YSJ we got such a good range of experiences. They make sure that you have community placements in hospitals, placement in physical and mental health. So, and kind of they want to balance it out, so you really know what you enjoy most and where you want to go.
Yeah.
And you identify that quite early.
Yeah. So where I work right now, I was on a 2.5-month placement when I was a student on a different ward, but I loved it so much, and I got on with the team really well that when there was an opening, they messaged me to apply, and I applied, and thankfully I secured the job. So I am there now as a permanent occupational therapist, and that happens with a lot of people. Where they go on placement, they end up securing jobs there, both because they really enjoyed it and because people want them back. And that's a plus that can always happen for you and for anyone. But yeah, YSJ was a very positive experience.
Yeah. So we hope that you understand occupational therapy a little bit better now and have a little bit of insight into what we've been through and what we've done and what we now do. and why we love it so much and why we love York St John so much.
Yes. Thank you.
Thank you.